can use cognitive behavioral therapy that works to a point because it's a therapy that kind of stops some thinking in its tracks. And what's good about that kind of therapy is you can implement coping strategies and practice them, so they have homework to do. So it's something that holds them, can hold them accountable, and can also normalize some of their thoughts, because a lot of ADHD children and adults feel very different. They feel like they think differently, and they are socially, they adapt differently. So normalizing some of the characteristics or the symptoms of ADHD also can help a child kind of learn to accept that this is part of who they are. Also, I do a lot of play therapy because ADHD kids need hands-on. So they're very kinesthetic. So we do a lot of play, like some sand work or Play-Doh or even artwork. And we try to make a mind-body connection. So there's some mindfulness in there. Like we'll do grounding exercises and yoga, or things that help let them get some of the busies out. And also, problem solving, time management. Like and I involve the parents with that too. So this helps a lot with transition time, and being able to prepare for the day even. So I've got a timer that shows the time. So I'll say, okay, in 15 minutes, this is what, and then they can watch the time if they need to. And we can incorporate that into something to take home with. Like, one of the biggest issues is screen time. So if a child has screen time and parents say, okay, you've got 5 minutes, you need to get off, or sometimes parents come in and say, okay, it's time for dinner, wrap it up, and they can't process that. So by giving them a pause to say, okay, this is what you're finishing up, kind of a closure of, okay, you're done, in 5 minutes, we're going to start this. So trying to teach them those skills and helping the parents incorporate those skills at home too can be really helpful.